when we talk about genetics and then fighting off an infection, so how much can your body fight off the HPV infection?
9 times out of 10, the HPV virus is cleared. So it's a very small population of patients who actually develop cancer from the HPV infection.
And now putting this one out there, I mean, how much does economic status play into being infected with, let's say, something that can put you at risk for cervical cancer?
I mean, definitely it is known that in third world countries where there's no good screening methods, the incidence of cervical cancer and the death rates are higher.
Right.
Because the cancers are caught at a later stage. And so curability is directly correlated with stage at presentation.
Because that access to screenings at this point, whether in a third world country or even sometimes, unfortunately, here.
Absolutely.
That would put you at risk.
Absolutely.
Now, we talked about age a little bit. It sort of hits at any age, but for cervical cancer, is it more prevalent as you catch it, as you said, because we see something like HPV start affecting in that college years, and then cervical cancer takes a few years to even show.
Yeah.
So are we looking at later age?
I mean, 30 to 50, I would say.
Okay.
Yeah,
certainly. But I think Dr. Garcia-Serra mentioned this earlier on. I mean, I've treated very, very young women with cervical cancer, even in their early 20s. I even once had a patient in their teens. And we do see much, much older women also develop cervical cancer. So there is a peak. There is a peak incidence somewhere around the late 20s to 30s and into the 40s age group. But certainly cervical cancer can strike at any age.